Good evening, everyone. I'm just letting all the participants into this evening's webinar, so just bear with me for another few seconds. I'm just seeing the numbers ramping up there for the attendees this evening. We're expecting around between 70 and 80 joining us this evening, which is wonderful. So I will just give it a couple of seconds while I see you all join. So I just want to run through a couple of housekeeping aspects before we get going. For those that you don't know my face or my name is Rebecca George. I'm Chief Executive of the Isle of Man Chamber of Commerce. This area here, early years learning, is not usually something that Chamber gets involved with, but we were very happy to work with Chrissy and Stephen and Dr. Ewart again in terms of hosting this webinar on behalf of the department. So I'm here purely in a capacity of host and moderator, but please, utilise our service going forward if you need any further assistance. The way that this Zoom webinar works is that it's now being live recorded. We, as the panelists, cannot see or hear any of you as participants. You are all muted with your videos off, so don't worry about any background noise or anything going on in the background. As I say, this is being recorded and will be uploaded to our YouTube channel at some point this evening once it's ready. So you can re-watch it again and share it with other colleagues within your workplace. Couple of housekeeping points. You'll see down the bottom of your Zoom window, you'll have a live Q&A box. So within that, you can post live questions while the panelists are speaking. So if you think of anything that you might want to ask for elaboration on, please pop a question in your Q&A. We do also have the chat option as well. You should have a raise hand option. If you wouldn't mind clicking that, that would be wonderful, because that shows me that you're all there and you can hear me and everything is running okay. And that is fantastic. I can see everybody's hands up in the air, so that's really, really good for me to see. So I'm going to lower your hands back down, so if you need any attention, please raise your hand and I will deal with that as we go along. So what we're going to do first of all is go to Chrissy, who will sort of give you just going to set the context for this webinar and give you an update, and then we will hand over to Dr. Ewart for a general update before we move on to the questions that have been submitted through the question portal. So Chrissy, I'll hand over to you and I'll unmute you there.
Hello, good evening everyone. This is really great, isn't it? How exciting to see 82 participants in our first webinar for early years. Hopefully we can do some more of these in the future. We're delighted to welcome you here this evening to our first webinar, and I really want to say a huge thank you, Rebecca, for sorting and organising all of this. All of the techie side and the organisation has been absolutely fantastic, so much appreciated to you and the Chamber of Commerce. Obviously, we appreciate these are unprecedented times. We all know that, and constantly changing times. And we're all, in our own way, in our own jobs, in our own roles, working our way through this. Thank you for sending in your initial queries and issues. That was fantastic, and that helped us to create the guidance, which we hope you found useful so far. Obviously, it's not set in stone. Guidance is evolving, and the whole pandemic and the whole arena is constantly evolving. So, please do keep the questions coming. Hopefully this evening we'll give you an opportunity to ask further questions, which you've done. There have been some fantastic questions coming in. We hope that you'll keep doing that. And Rebecca will talk about how that can work on the portal at the end of the session. The guidance will evolve. We will update the guidance. It's best practice that we're putting out there to support you as you either expand your provision or you move to reopen. And I know some of you are working towards that. We're absolutely delighted that Henrietta, Dr. Henrietta Ewart has joined us. she's done an amazing job leading us through this pandemic as Director of Public Health. You know, I think we're the envy of a lot of people around the world with how well we've done here. So thank you for that. And we're delighted because we know how busy you are, that you've given up your time to be with us this evening, Henrietta. So I'm going to hand over to you now to give us a little bit of an update. Yeah.
Right, just doing the unmuting thing there. Sorry for the delay. I can never get my finger on the right bit, but anyway, I think I am unmuted now. So thanks for that intro. And it's very good to be here. I'm very happy to give up an hour to do this. It's no problem at all. The very good news is that, as Chrissy mentioned, we are actually in an extremely good position regarding COVID on Ireland at the moment. We've gone 20 days with no new confirmed cases. We have no active cases. The last person who was a confirmed case of COVID was discharged, fully recovered a few days ago now. So to all intents and purposes on the island, we can say that we are currently COVID-free. We cannot rule out that there may be a very low level of asymptomatic or incredibly mild virus disease in the community. But the more days we go without anybody testing positive, the more certain we can be that even that is no longer the case. So going forward, the main risk to us will be around imported cases that cross over our borders, because obviously we can't fully seal our borders in the way that, for example, New Zealand has done, because we're dependent on transfers back and forth from the UK for provisions and also for things like people going for essential medical treatment and essential workers coming here. So we can't quite seal things off like we are in New Zealand, but we are in a very good position, and we do have very strong test and trace systems in place so that if a case is identified, we should be able to get on top of it while it is just a single sporadic case and control the spread to avoid return to sustained community transmission such as we had in March and April. So that is all extremely positive, and it means that the background risk for all of us now of catching COVID here is very low. And it's on that basis that we can be planning for the reopening of all businesses within the current guidelines, which are of course constantly reviewed as time goes on to see what further restrictions can be reviewed.
Excellent, thank you very much, Dr. Ewart. We're very lucky to be able to have such an up-to-date progress from you, so that's wonderful. So what we're going to do now is move on to all the questions that were submitted by you all, and Chrissy has organised these into certain areas so that we can try and move those through in a nice focused and organised manner. So I will kick off under the area of clothing and shoes for children. So these questions really aimed at Chrissy and Henrietta. So why do children need to change their shoes on entry when they have the same clothes on? And under uniform, please can you clarify how this policy will be operated by the schools? Will school children be wearing non-uniform? And will teachers be required to change clothing when they enter and leave school premises? This is particularly relevant to after-school provision.
Okay, shall I pick up on the school aspect? I double-checked this today just so that I was absolutely clear. In terms of schools, what they've done at this point is for those children who've been attending the hubs, they have relaxed any uniform rules, and that's to allow all children, whether they have a lot of uniform or not, the ability to change their clothes on a daily basis. So the expectation is any child going into school, you would hope that they would come in with clean clothes every day, and that doesn't necessarily have to be uniform. The guidance for teachers has been the same, in that they are expected to when they come home take their clothes off and to put them in a separate washing machine, because you've been exposed to quite a lot of children. Obviously, as the risk lowers and Henrietta, I'll hand over to you for this bit. That will obviously change. But the aim was just to try and keep your clothes as clean as possible. And again, this is just guidance.
Yes, shall I come in there? Really just to say, yes, that's absolutely right. And as Chrissy said, you know, the issue is that your clothes are in a way mirroring your interactions with all the people you've interacted with in the day. And what you don't want to do is then take all those interactions back home and pass them on to your household members. So hence the change of clothes, in much the same way that hospital staff would come out of their uniform before going on public transport, going home, etc. Again, as Chrissy said, as the risk lowers, the importance of doing that drops. If the risk rises again, and obviously we can give no guarantee that that might not happen, but we will of course keep people updated if it does happen, then one might say, you know, try and tighten up on this if you've relaxed a bit. Specific issue around shoes would be that obviously shoes make contact with more surfaces than your clothes. Your clothes are more likely potentially to be touched by others, particularly with young children, but your shoes are touching a multitude of surfaces that may have picked up all sorts of things. So soles of shoes are a particular issue around that, and hence, you know, the guidance around taking them off at school entry.
Henrietta, can I just pick up on one issue? In terms of arriving from home in your clothes, and that's something we suggested, can we relax that in, you know, is there a need for someone to arrive at their nursery playgroup or, and actually change their clothes on arrival? What would your advice be around that?
Again, I suppose to avoid bringing the reflection of your home household into the school setting, one would say yes, but frankly, if nobody is symptomatic in your household, and if they are, you would be, you know, probably have been advised to self-isolate anyway. To be honest, it's kind of a mitigation that is probably not going to mitigate much at the moment because the overall risk is very low.
Thank you very much. Okay, so I was just dealing with a live question there that was around whether you know, you change into uniform when you get into to the workplace. So clothing on staff, I think we may have covered this, but so change of clothing on arrival to the nursery. I understand if using public transport, but to change out the clothing from home to change into clothing you bring from home, is that necessary? And what about their children they bring with them? Does this apply to them as well? So if you're working in the nursery, bringing your own child in, does it apply to them as well?
Yeah, I mean, this is where we're getting into sort of finer and finer detail. And, you know, if the risk is very, very high, you're probably wanting to go along whatever mitigation you can. Now, one can probably be more relaxed unless people feel that having a constant routine that people will just keep following because they've got in the habit of it and it will stand them in good stead if the risk goes up, then that's fine. Again, it's just whether you're bringing in contacts with wider individuals from your own household, but the risk is going to be low. So I think, you know, it's guidance and take a call on what seems to be appropriate and easily workable.
Thank you, Henrietta. So moving on to outdoor trips, a couple of questions around whether childminders can go into parks now. As we enter the new normal, at what stage can we as childminders start to take our mindees to the parks? At the minute, we can only take them for a walk and they must not mix with other children while they're out. For a childminder who has only maybe one mindee, how do we meet their social needs?
Currently, there are still restrictions on gatherings, but I think this is going to relax fairly imminently. So it's really a question of keeping up to date with the latest guidance. Obviously, getting outside, getting some exercise, getting some sunlight to top up the vitamin D levels is extremely important. And the guidance on distancing and interaction with others should be followed, but it's a question of watch this space because if things continue as they currently are, it will be changing fairly imminently.
And just to come in there, parks are now open, so you are able to use the parks. So again, it's just watching the guidance as that changes, to see, you know, in terms of other people in relation to that. Excellent,
thank you very much. Moving on to temperatures, a few people had some questions around taking temperatures. Temperatures on arrival of children, is it mandatory or is it just guidance? You know, there's concern that after children being away from nursery for some time, it may cause a bit of upset, and people are wondering how necessary it actually is to take temperatures on children's arrival.
I would be very open on this one. I think the evidence for the value of temperature checking to rule in or out people coming into either the school setting, children, or indeed, you know, adults going into a workplace really is not good. You will miss about as many cases as you would pick up, and you will also get a lot of false positives and more difficult to deal with. Potentially a lot of very borderline ones where somebody is like 0.1 of a degree above, absolutely no symptoms, then what do you do? I take the point that was expressed in the question about, you know, children potentially being upset. It's quite a difficult thing to do with them. I would not be pushing for this at all from a public health perspective. I think it's much better to get over the message that if a child has any symptoms, don't bring them in. And if they develop symptoms during the day, then, you know, take them home again.
Excellent, thank you, Dr. Ewart, that's wonderful. There was another question around whether people need sophisticated temperature thermometers, but I get you've really answered the question that no, they don't. It's really not necessary even to take the temperatures. So we're now moving on to an area around testing for COVID-19 and contact tracing. If a child in my care develops a temperature above 37.8 or classic symptoms of COVID-19, I will contact their parents and send them home as per the guidance. But do I inform the parents of the other children in my care that I have sent a child home with a temperature? Do I send them all home and close, or do I wait for a confirmed COVID-19 diagnosis?
You wait for a confirmed COVID-19 diagnosis. Infection rates in children, even when COVID is circulating, are very much lower than for other age groups. And having classic symptoms, a child having the classic triad of, you know, change in taste and smell, which a child probably isn't going to express or be able to express really anyway, plus the new cough and the temperature. There are lots of other things that would cause, you know, cough, snuffles, possibly being a bit listless, a bit hot. So COVID wouldn't be your top diagnosis. So I don't think there is any need to be telling other parents that you've got a possible case of COVID. You've just got a child who's poorly and has gone home. And it's then for the parents to make the correct, getting in contact with 111, getting assessed and having a test if indicated. If that test is positive, the contact tracers will contact the nursery very quickly. Speed is of the essence with the test and trace, and they will then support the nursery in working through how to identify all the contacts and what needs to be then done.
Thank you very much, Henrietta. In the guidance for nurseries, it's stated that when a child or an adult receives a positive test, a single case would not usually be an indication to close a nursery or a playgroup unless there were specific factors in that case. Could you offer some details on the specific factors that would lead to closing a whole nursery?
Yeah. When contact tracing is done, the close contacts who are advised to self-isolate are those who have spent longer than 15 minutes within a distance of 2 meters face-to-face, or longer than, I'd have to check the list, but I think, you know, it's sort of like the entire session in one room poor ventilation, etc., etc. So if you are keeping to the guidance on having a kind of group bubble of staff and a small number of children, potentially that group bubble would be close contacts and they'd be advised to self-isolate, but you wouldn't need to close the whole thing. So the obvious specific is if you haven't been able to maintain that kind of grouping and bubbling, and actually for some reason a much, much bigger group were within the definition of close contact, and when you've excluded that much bigger group, if that actually effectively closes the whole nursery, that would then close the whole nursery.
Yeah.
But usually it would be possible to do it with much smaller units within the nursery rather than the whole thing.
Thank you, Henrietta. Somebody's just popped on the chat. If we send a child home with symptoms, do we need to immediately contact R&I?
I can come in here. Under Regulation 10 of the Regulation of Care Act, they will need to notify us
So is
within
that in
24 hours.
Is that if there is a positive COVID case rather than just somebody showing symptoms?
It would be if somebody's showing symptoms, and then we would expect to follow up after the test results have been.
Yeah.
Yes.
Excellent. Thank you, Stephen.
Okay.
Somebody has written the COVID-19 tests, should they be done every week? Is it optional? Should the manager make her staff have a test, or is it only if somebody feels unwell? So just some guidance around that.
Right, now this is around the screening tests. So this is the PCR test, and it answers the question, am I infected now? Okay, and we are offering them to certain employment groups, including early years, so that they have the opportunity to see if any staff are infected but asymptomatic. Okay, because it's now recognised that people can have COVID, and they can either be pre-symptomatic because you become infectious about 2 days before you actually start having symptoms. It's also being recognised that some people actually can be infected with COVID and never develop symptoms, but they can be infectious. They're less infectious than people who do develop symptoms because they're not coughing, and obviously coughing is the thing that spreads droplets far and wide. So they would only be spreading droplets really by talking or shouting, and you know, that does not propel droplets around the place in the way that somebody with a cough does. So it's a lower risk, but it's still a risk. And we do now have sufficient testing capacity that we can offer staff in these defined groups to come and have a test every 7 days just to see if they are infected. And if they are, then they can be excluded for 14 days, which is sufficient time to let the virus clear fully out of their system, whether or not they do actually develop symptoms. Now, we're offering those tests. We can't compel anybody to have them. And actually, with the current very low levels of COVID here, it's not such an important thing as it might be when we had higher levels. It is still useful because it does enable us to keep our finger on the pulse of, you know, is there still a very, very low level of virus circulating here, kind of under the radar. But it is up to individuals whether they want to have the tests, and we wouldn't be coercing anybody. And I don't think managers or employers could enforce testing for their staff either, as I understand it.
Thank you, Henrietta. Just for clarification, someone's asked, is the PCR test, is that the same thing as the antigen test?
Yes, it is.
Right, yeah, but they're one and the same thing, right? Okay.
Yeah. It's the test that actually picks up viral RNA, so it detects bits of the virus actually being present, and that's obviously an acute phase thing, you know, either when you're asymptomatic or you have symptoms.
Yeah, fabulous, thank you. I'm just seeing if there's anything come in around this topic. Is it recommended that if you are found to be positive that you continue to have weekly tests afterwards?
No, you shouldn't need to.
And what is the benefit to having the antigen tests?
Well, if you're identified as positive, you know you've got it and you can be taken out of the work and indeed avoid others in your household situation, and avoid any risk or massively reduce the risk of spreading it on to anybody. As I say, some of those people would have gone on to develop symptoms anyway, but catching them early while they're still asymptomatic will just reduce the possibility of spreading it in the couple of days while they are infectious but haven't got symptoms. And as I said before, some people will be asymptomatic throughout, so testing will enable those people also to come out of the situation of being with others and reduce spread.
Thank you very much. In the document for nurseries, playgroups and childminders, it is mentioned that there will be an outbreak management team. Can you clarify who is on this team, and will the settings have a say in what happens if cases are reported in their setting?
Yes, indeed. An outbreak management team is convened once we've determined that there is an outbreak. So obviously from the testing and the analysis of the results and then contact tracing, we identify associated cases. Now, sometimes those associated cases might be random. It might be somebody who was in Tesco's at 9 o'clock on Saturday morning and another person who was in Tesco's at 10 o'clock on Sunday evening. So it's a casual association. It's unlikely to mean that Tesco's was in any way, relevant to the transmission. But clearly, if one found a couple of cases in a nursery, preschool, or indeed a school setting, then one would be wanting to see whether those cases were causally linked. And if it was, two children in totally separate year groups who we can't find any evidence that they came into contact with each other, then maybe that would not be high on the list of suspicion for an outbreak. But if it's two in a class, or there's some other link that looks very plausible that the things are linked, then we would class it as an outbreak and we would convene an outbreak team for that specific outbreak. And that would include health protection, public health staff, it would include contact tracing staff, other DHSC staff probably, and managers and staff from the setting that was affected. They would actually be part of that outbreak response team.
Excellent, thank you, Henrietta. And actually, just to expand on that slightly, somebody sort of said, so how far does that contact tracing extend? For example, if a child's auntie, who the child has spent some time with, tests positive, and obviously the team would contact the child and the child's family, would they go as far as to contact the nursery that the child is going to as well?
No, they wouldn't,
Right.
because obviously they haven't had a case in the nursery, unless, of course, the auntie had some closer connection. But if it was just an auntie kind of in Ramsey and the child's in a nursery in Douglas, then not.
Yeah, thank you. Can it be confirmed if a child splits their time between a childminder and a nursery? Is this allowed, or do parents need to just pick up from one place at the moment?
I mean, with the current risk level, I don't think that the reason to avoid that is to avoid the child being in two bubbles and being analogous to, like we said, with the clothes and the shoes. You're potentially merging two bubbles through that one child. But if it's a single mindee of a childminder, that's a much, much lower risk. So there is something about being proportional, and particularly given the level of risk that we've got on the island at the moment. Optimally, I suppose one would have to take the purist approach and say that the child should be in one minding bubble or playgroup bubble, and not crisscrossing between two. But the risks at the moment are low, so if they're a single mindee and there is no other sort of risk issue in the picture, I think assessments and calls can be taken on an individual basis.
Yeah, Excellent, thank you. I've had quite a few questions come through on the live Q&A, so I'm just going to do a couple of those. A couple on messy play. Can we do messy play as long as we wash our hands regularly?
I mean, the guidance at the moment that we have is that you can do messy play, but just doing it individually with the child, or making sure that the children, I'm sure you'd agree, Henrietta, wash their hands. I think the most important thing is that you wash your hands. So it's about good hygiene practices. And making sure that if you dispose of that messy play. So, for example, if it's Play-Doh, get rid of it when you've used it, so that you're not sort of reusing it over and over again.
Yeah, I think that's absolutely.
Excellent, thank you. Just while we're on hand washing, are hand sanitizers suitable for use with very young children?
Soap and water is definitely to be preferred for young children. If it's unavoidable to use, you have to use sanitizer, you can. You know, if, for example, you've been in the park and been on playground equipment, you might want to use hand sanitizer as you come away if there isn't washing facilities easily and readily available. The child needs to have the sanitizer applied really by an adult, and it needs to have dried completely. The main risk with small children and sanitizer is that they lick it, and that's not really a very good idea.
Can I just come in there as well, Henrietta, to say I spoke with Adrian Mooney today about hand sanitizer as well, and what he suggested was that if you are, for example, using a dispenser, think about the height of that dispenser, because obviously if it's above a child, it could end up going into their eyes. So just be very mindful of that, and making sure, as Henrietta said, that no child applies sanitizer themselves. It's not something they should be doing themselves.
Thank you very much. Somebody's asked if parents are to hand their children over at the door and the child becomes distressed, is there any advice that can be given around this with regards to supporting staff and families in this scenario?
Again, I think it's working with the family. You know your children best, you know your families best. I mean, at the moment, again, Henrietta, please come in here, obviously with the changing climate, the guidance at the moment says we don't want lots of adults inside a nursery building, and to meet and greet at the door. But obviously you wouldn't leave a distressed child distressed. And it's again the same practice that you would do were the child inside the building, just to settle them down. I think as things change and the climate changes, we can continue to seek advice on whether or not we can allow parents into the building. What's your opinion, Henrietta?
I think that's absolutely right. Yeah. Yeah, you have to do what's pragmatic, really, and take into account the background level of risk.
Thank you. Henrietta, we've asked if you could advise regarding staff that have health issues or those living with vulnerable people, vulnerable others returning to work in the nurseries. What's the level of risk in that case?
Right, so we've already said that the background risk for everybody, fortunately, is now extremely low. So that means that for the people in the clinically vulnerable and the clinically extremely vulnerable groups, their risk of catching COVID on island is exactly the same as for all of us, but they still have the issue that if they were to be unlucky enough to catch it, the implications for them would be worse. They'd be at much higher risk of severe disease and complications if they caught it. Now, because the risk is so very low now here, we are encouraging people in those clinically vulnerable groups to start thinking about how they can get back to something that looks a bit more like life as normal. Because we're getting to the point now where the very low risk of infection has to be balanced against the equally real and now actually rather higher risk of all the negative impacts on our physical and mental health of staying shielded or in self-isolation at home. So we're encouraging people in those clinically vulnerable groups to start thinking for themselves how they feel about the balance of risks and start exploring what they want to start doing now. Obviously, simply put, the best thing they can start doing now is going out to take some exercise, physical benefits, mental health benefits, vitamin D, etc., etc. And they can also start thinking about how they want to interact with other people within the existing guidance, and given that that guidance is likely to widen in the very near future if things carry on as they currently are. That means that people in the clinically vulnerable group, which is everybody over 70, people with conditions like diabetes, asthma, high blood pressure, pregnant women, can actually start thinking about whether a return to work would be appropriate for them. If they can work from home, they should continue to, as should everybody really at the moment if they can. But if they can't, then they can start discussing with their employer whether it's going to be safe for them to come back, whether in the workplace the employer has got appropriate mitigations in place around social distancing, hygiene, etc. So in terms of the nursery setting, obviously social distancing one can do as much as one can, with encouraging children to do the spacing, using all the things like hula hoops and, you know, designated spaces for the child to occupy. And to an extent, kids seem to be quite good at engaging with things like that, but there is always the risk that they won't or don't do it all the time. Against that, we know that children, and particularly younger children, are very much less likely to be infected by virus, even when it's around at high levels, than adults are. And the evidence is also that they are less likely to transmit it. So that's good, but we can't ever say anybody is 100% safe. So people do have to think through for themselves how they feel about those different risks and the different levels of them. If we think about the clinically extremely vulnerable group, that's people who have had conditions like cancers, who've had chemotherapy, who've had a bone marrow transplant, who've had a heart-lung transplant, who have cystic fibrosis, really very serious conditions where COVID would be very, very serious for them. And I think, you know, again, it's for them to balance the risks, but they might very well not yet feel ready to come back into a workplace. In terms of their household members, that's something really for families to sit down and discuss, and whether, you know, there are mitigations that maybe the person who is extremely clinically vulnerable can just distance within the household to avoid those who are going out to the workplace, not eat with them, not share kitchen or living facilities with them, or what have you. And that's really for families to have that discussion and decide what the best mitigations are now for them.
Excellent. Thank you very much, Henrietta. Question around sunscreen. Somebody was asking, they're curious how the hub schools have dealt with the sunscreen, application of sunscreen. Are you recommending that people use the P20 so the parents can apply that first thing in the morning? Just obviously with putting sun cream on, it involves physical contact.
Yes, I think using a long-lasting formulation that can be applied before they come to school is certainly not at all a bad idea. And actually using other mitigations, like, you know, the little hats with the neck flap that protects, you know, the very vulnerable area at the top of the neck, making sure they're wearing, you know, appropriate t-shirts and keeping covered up, as well as using the long-acting sunscreen. I don't know if Chrissy's got any tips from experience.
Yeah, yeah, absolutely. I mean, in terms of children in school, they're usually old enough, apart from obviously reception and maybe a few year 1 and 2s, to apply sunscreen themselves. And in schools, we do encourage them to do that. In terms of children needing sunscreen during the day, Henrietta, what would your view be on in terms of applying that during the day to a child? I mean, obviously people who are nappy changing are applying things like Sudocrem, etc. Is it about mitigation? Is it about hand washing before and after?
Yeah, I think absolutely it is. It's about, again, making sure you don't have symptomatic children in school, and then it's about hand washing before and hand washing after. Yeah.
Excellent. Two questions have come in around the same topic, around parents contacting nurseries or childminders about taking their child from September. When are they allowed to sort of come in and have a chat, you know, and have a look around either the home or the nursery? Could you give any advice on that?
Chrissy, I don't.
Yeah. I mean, I think that in terms of actually bringing again more adults into your nursery, I think at present probably discouraging that. However, there are ways of that people have been quite creative in the way they're approaching this. So, you know, a virtual tour of your nursery, or a Zoom call, something like that, so you can actually share some of that information. I think at the moment, bringing a lot of new people in, there's no reason why you can't accept new children. A lot of people are doing social stories so that you can actually introduce a child to, here's my nursery, when you come in, this is what it will be like, this is the water play, this is the, you know, where you'll have your snack, etc. So the children become familiar with that. And we are actually developing some guidance at the moment for you on transition during COVID, because it is a new normal. It is very, very different. So behind the scenes, we've been working on that over the last week or so, and we will get that out to you. And we've also worked with people from Guernsey and Jersey. We work very closely with them. So we've been sharing ideas on this. So would you agree, Henrietta, in terms of not bringing additional adults into the setting?
I think, you know, on the same basis that we've said before, avoiding sort of mixing people from different households, different bubbles, definitely. And the ideas you've just given, I think, sound very good.
Excellent. That's good to know there's some more guidance coming on that as well. Just around cleaning and soft furnishings in childminders' homes, is there any advice on particular cleaning products and the best ways to keep soft furnishings clean?
I think one of the key things is to make sure that all removable ones are removed. So, you know, cushions and things that you don't need to have there, take out. In terms of, I mean, if you've got furniture that is effectively a sort of wipeable surface, so leather or, you know, plastic covering of some sort, then that's easy to sanitize at the end of the day. If you haven't, and you've got sort of a loose throw that you can put over soft furnishings and then take that off and put it through the wash at the end of the day, that would be a way to do that. And again, sanitize all the hard surfaces at the end.
What I've done is I've spoken to the DOI, although they're a government department. I asked their advice around cleaning and how you do really good cleaning. And if you don't use Mrs. Hinch's ideas, some of you might watch her on YouTube. We've got some great guidance from them that we're looking to amend, not to say this is how you clean, but just to say, have you thought about doing it in this way? So a lot of people have asked about carpets and, you know, the best way to clean carpets, you know, what sort of things you use to clean surfaces. So we're currently just putting a little bit of, again, guidance, not telling you how to do it, around some good ideas for enhanced cleaning protocols at the moment.
Excellent. Thank you very much, Chrissy. Just moving on to food, what are the reasons behind not providing hot food, and what is the reason for not storing lunch boxes in a fridge if they are sanitised on arrival?
Okay, do you want me to come in here? Steve and I have done some research on this today, and the reasons around school are very much more around social distancing, around staffing, etc. Having had a discussion today and looked into this, I think, and again, we'll take your advice here, Henrietta, that to be honest, if you've got one person cooking the food in your setting who's providing that for all the children, would there be a risk in moving to be able to do that?
No, if you can do that, do it that way. It's really just, you know, to avoid people trying to cope with too much and too many things. But if you can do it, no reason why you shouldn't.
Great. So we'll amend guidance, and obviously people can then start doing that from sort of moving forward from now, in order to be able to provide meals at your setting.
That's excellent, because there was just another question here. It says, we have a cook who prepares a cooked meal. I would look to replace this with a cold lunch. Having to wipe down 20+ lunch boxes is very time consuming. is it not less of a risk if we just have one person making sandwiches and serving to them? That way the food is just coming from one place, one person, and all the dishes are washed immediately. So sounds like that solution can be offered, which is great. What about water bottles as well? The guidance is that bottles are kept in the setting and they're not taken home each day, and yet lunch boxes do get taken home each day. So can there be some clarification around that?
Yes, I suppose lunch boxes need to go home to have the next day's lunch put in them, whereas a water bottle doesn't, because you can fill it up in the nursery. It doesn't need to go home to get the water put in it. But I think, you know, you don't need to be hard and fast. It's pretty low risk. Surfaces are low risk anyway. So, you know, you really are mitigating absolutely as far as you possibly can. And there is flexibility. It's not hard and fast mandatory.
Yeah, somebody's mentioned baby milk as well. Obviously, similar, you know, situation. The baby milk will come in fresh every morning. So that's food. Oh, somebody said, why can't we store lunch boxes in the fridge? That's come up a couple of times.
I can come in here. I think as time has moved on, even within the last week, the risk has lessened as far as lunch boxes. If they're sanitising them, then they could go in the fridge, but it's up to the provider how they store them. We would still advise that you keep them out of your own fridge if you're a childminder, and if possible, that parents can provide an ice pack. I think that would be better.
Yeah.
Yep.
Yeah, thank you, Stephen. What about providing maybe disposable cups and advising parents not to bring bottles into nursery?
Again, that would be up to the nursery.
Excellent. Okay, so moving on to organisation and staffing. In an open plan setting with 2 staff, is it acceptable to have 2 staff managing 16 children? The 1 to 8 grouping will not work.
Okay, I can answer this one. I mean, obviously, the smaller the group, the smaller the risk. Right? And settings will need to risk assess themselves and make provision for when staff have comfort breaks and lunch breaks, as there cannot be one member of staff left alone with the children. Right? Most settings will have bigger settings will have a supernumerary person who could step in whilst one of the members of staff goes on their break. Right? We would prefer there to be 2 groups of 8 as opposed to 1 group of 16, but that's only because the smaller the group, the smaller the risk.
Thank you, Stephen. Try not to mix staff and children becomes much more difficult towards the end of the day when numbers of children and staff are low. What's the guidance on this?
Right. Again, as settings need to manage this, that it may be that as the changes in the groups happen when children go home, that it might be an opportunity for the children and staff to kind of regroup and wash their hands for the 20 seconds, and just to reduce the risk of creating another bubble, so that you have 2 sets of 8 that then become 1 set of 8, but it could be an opportunity for them to practice good hygiene.
Thank you.
Henrietta?
Yes, I think that sounds right. I mean, the problem is if you mix your bubbles, and if you were unlucky enough to get a case, that would probably close you down, because you'd have had everybody exposed. So yeah, that's another reason for trying to keep the bubbles separate as much as possible.
Just while we're on bubbles, someone said, are you expecting bubble groups to remain with the same staff member all week, or is it just on a daily basis?
I mean, we wouldn't we wouldn't actually stipulate how a setting manages their own staff and that. I mean, again, it's about reducing the risk. So you know, the smaller the bubble, the smaller the risk. And if you've got, you know, if you could do it on a sessional basis or a day-to-day basis, not all children will be there all day. It might be that you need to regroup at some point. But it's, you know, we wouldn't stipulate whether they have to be with the same person on a day-to-day basis or the same person for all week.
Thank you, Stephen. Are there going to be issues with changes to room capacity which affects overall numbers? And how many children is too many in one room? Approximate room size 400 square foot, which means nothing to me. I'm terrible with things like that.
Right. There are minimum standards in respect of the amount of area each child requires, and that changes with age. The younger the child, younger children require a bigger area. Right? Those are still within the minimum standards, and they will still remain. There's been no relaxation of that standard.
Excellent. Thank you, Stephen. Just before we move on, while we were discussing bubbles, how long does it actually take to establish a bubble immunity, if that's a thing? So would it be the 14 days, or how long does that take?
It doesn't really work like that. It's really just trying to keep down the numbers that are interacting. It doesn't really act as a protective thing for members of the bubble. It just means that if there is a case, you've only got to contact trace within the bubble. You don't have to take it across the entire setting.
Yeah, makes sense. Makes sense. Right, so greeting children and their parents in the morning. The current policies ask that children are handed over to staff at the door. However, we have concerns about this procedure and the possible distress that may have been caused. I think we might have touched on this already. You know, so if a child is distressed on arrival, the parent is going to feel more comfortable, want to come into the nursery to support the settling of that child. So I do think we've covered that, but I don't know if you just want to quickly add to that, Chrissy.
Yeah, I think, again, it's just about the same things you would do inside, doing outside. You know, it's not ideal. We are in a strange situation. And, you know, I think we've got to consider the well-being of the children. We all know that little children need a love, a cuddle, all of those things. You know, we don't want that to stop. But I think at the moment, until we seek further guidance and we look at how things are continuing to move forward, we need to mitigate by having less adults inside of, you know, or not having additional adults inside a building. Hopefully this will change, you know, as we continue to move forward. Can I just pick up on something else as well? Some people have been putting on the live feed about, you know, maybe allowing viewings in the nursery at the weekend for new people. Now, I don't know what you think, Henrietta, that could work if you made sure that your cleaning protocols were in place following that. So that might be a really nice creative way, I hadn't thought of that, of actually addressing that issue with new children.
Yes, I think that's a very good idea. You know, make sure you sanitize all the surfaces afterwards, and you know that would be a very acceptable way to do it, I think. Yeah,
fabulous. Right. Guidance. Is the guidance document guidance or instruction? We have this across all the sectors. You know, what's the consequence of a nursery or a childminder not implementing the guidance?
We do this together. I mean, it's guidance. It's a guidance document. There is one part about the relaxed standards. That's a statutory thing. But actually, it's guidance. What we've aimed to do is to look at your issues, your concerns, and issues we picked up on, and try and address those through the guidance, and also working with those providers who've remained open throughout the pandemic. Because do you know what, we've learned such a lot just from those daily conversations on good practice, what's working well, things we hadn't thought of. So a lot of that is actually included within that guidance. So I would see it as best practice guidance. You're not going to be inspected against that guidance. Steve, do you want to come in here?
Yeah, I just to reiterate that, yeah, it is guidance, and that's been based on advice that we've gathered from a number of different areas, including Henrietta's department, who we've relied on quite a lot. We've looked at what they're doing in Jersey, in Guernsey, in other places as well. And we've considered everybody's questions. And, you know, it's a reflection of people's anxiety as well about trying to support people in giving them ideas of things to think about before they open or while they open. And to look at that document as something that's quite fluid, that will develop. It's not a static document like the minimum standards are. It's a document that will develop as the situation changes.
And just while we're on the subject of inspection, Stephen, a couple of people asking about at what stage will the standards go back to the minimum requirements, and will everybody get a good notice period before this happens? And when are inspectors going to resume the cycle of inspections, and how they're going to be able to do this when it means mixing between different settings?
Okay, there's a number of questions here. At the moment, we've got 2 full-time childcare inspectors, and they are currently redeployed to 111 service, answering the telephone on the COVID line. And you know, they're doing a brilliant job, and they've been very, very busy at times as well. Right, we have no plan to recommence inspections yet. Right, and when we do, we will only be inspecting against the minimum standards, not the guidance. Right, and at the moment, we'd only visit or inspect a service if we are concerned that the care of the children is not safe. Right, so we're not going to just turn up on your doorstep at the moment. Okay, with the question regarding relaxing the standards, we review it quite regularly, right? And you will be given some notice of when we stop relaxing the standards, particularly around the 50% qualified. We may not be able to give you a month's notice, but we will give you as much notice as we can. Right? And some of those relaxations may be subject to changes in government guidance. So if government guidance changes, then we can change some of the things that we've said. Okay. What I want to reiterate is that we've got no intention of increasing the risk in settings, and that when inspections recommence, and before they do, we will be following the guidance at the time. We're looking at other ways of gathering information. We've sent out things like pre-inspection questionnaires, which help us to gather information that is not dynamic. It's not actually observational. It's things like your car insurance, those types of things, right? And how much of that we can do in the office or at home, as opposed to actually visiting the setting, because you know we want to point out that we want the children to be as safe as possible, right? Because you know, every adult that walks into a nursery could be a carrier of the virus, including us, and we don't want to go unless we absolutely have to.
Thank you, Stephen. Okay, very conscious of time, and you know, I promised we would stick to 1 hour for everybody's sake. There's just a couple of questions that people have pushed through on the live Q&A that I just want to make sure are covered. And it may have been covered, it may have not, but because we've gone through a lot of content, so I'll just double check. So can a child come to our preschool in the afternoon when he's been at a different preschool in the morning? A couple of people who have situations where children have been in different settings throughout the day. Is that allowed? Is that okay?
It's preferably not, because effectively you've got 2 substantial bubbles there. So if they've been with a childminder as a single mindee, or with their granny as, you know, a single child, I think, you know, that's much less of a risk. But actually going from one bubble to another bubble is effectively mixing the bubble.
And similarly, is it okay for staff to work in multiple settings, working in a nursery setting and in a school? And I'm assuming they mean in the same day, yeah.
I can come in here. I think that there will be staff who will work in 2 different settings, right? But again, it's about good hygiene. If you are following good hygiene practices, and if you do change your clothes between settings, if you do wash your hands, etc., then the risk reduces, right? And it's about, you know, people being accountable for themselves, really, and that you know, if they are going into a new setting, they need to treat it like that, not just going from one part of a building to another part of a building.
Excellent, thank you. Just a couple of questions for Henrietta before we finish off. Just a couple of people asking how long it takes for you to get results for the PCR test, and is it a blood test?
No, PCR is the nose and throat swab, and the results should be back within 24 hours.
So that's wonderful, thank you. Now, I'm really sorry to those whose questions we may not have got to, because there's a lot. I hope pretty sure we've covered everything that came through on the question portal, but there's quite a lot that have come through on the Q&A live area. I've tried to cover them as much as I can. What I would like to say is that this webinar has been recorded and will be uploaded to our YouTube page, and I will share that link with Chrissy and Stephen as soon as it's available for them to share to you. But equally, the question portal that was opened in advance of this webinar will be left open for you indefinitely for now. So what Chrissy, Stephen and I have agreed is that please continue to use that question portal. If there's more questions you have following today's webinar, or things that you just still need a little bit more clarification on, it's a really good place for you to place your questions. Chrissy will have live access to that portal whenever she needs it, so can access those questions and get them answered for you. Chrissy, is there anything you'd like to wrap up on, or Stephen?
Yeah, just to say that there are questions that have popped up that we haven't answered. What we'll do is we will look at those. As I say, we'll go back over this, we'll look at them, and we will make sure that we come out to you with the answers to those questions. Obviously, we've sort of run out of time to answer everything, but we will get back to you with that. They won't not be answered.
Yeah, wonderful. And once again, thank you so much, Henrietta, for your very valuable time and guidance and advice. It's very reassuring for everybody. Yeah, thank you all for listening. And as I say, we'll follow this up and keep firing your questions through. Anything that wasn't answered, we're really sorry, but we have to stick to time limits. But I'm sure Chrissy and Stephen will. You're in very capable hands. So thank you all for joining.
Thank you.
Thank you.